Hello, and thank you for watching this educational video about the Choice Value 750 plan. The Choice Value 750 plan is uniquely structured to give you the power to make all your healthcare purchasing decisions based on cost and quality. Even though most health plans in the US utilize a PPO network to access local providers, the network negotiated price may not always be the best price. The Choice Value 750 plan does not access a PPO network. This means you choose any physician, facility, or other medical provider based on the value you place on the services they provide. The relationship is between you and your medical provider. You are free to use the provider of your choice without an in or out of network benefit differential. To determine the plan's allowable provider reimbursement, this plan utilizes reference based pricing. Reference-based pricing is a method of determining reasonable reimbursement for medical services. A reference price could be a price that is offered by a KPP-free provider or a price available from an online retailer like Amazon. Medicare is the most commonly used price reference to determine a reasonable reimbursement, since almost all medical providers accept Medicare and are familiar with the amounts of their Medicare reimbursements. The payment structure is easy to understand, and it is generally accepted as a fair reimbursement. In addition to being easy to understand, using reference based pricing has other benefits. Since reference prices, including Medicare reimbursements, are publicly knowable, transparency between providers and health plans is increased. Patients accessing medical providers who choose to accept the plan's reasonable reimbursement have open access and increased choice for their healthcare services. In the unlikely event that a provider chooses not to accept the plan's reasonable reimbursement, the patient may be billed for charges above the reference based price. This is called balance billing. Since the networks do not always negotiate the best deal for you and your plan, on the Choice Value 750 plan, the network's influence has been eliminated. The Choice Value 750 plan offers an aggressive, cost containment approach to controlling claims. Now that we have discussed what reference-based pricing is and why it is beneficial for you and your plan, let's review how this model works with your benefits. Since this plan design does not access a PPO network, all claims will be processed at the maximum allowable charge, which is often a percentage above the provider's current Medicare rate. If no Medicare rate is available for a particular service or provider, another reference will be used. Physician charges are processed at the provider's Medicare rate plus an additional 30%. Facility/hospital charges are processed at the provider's Medicare rate plus an additional 60%. Anesthesia charges are processed at the provider's Medicare rate plus an additional 150%. Outpatient laboratory charges are processed at 100% of the provider's Medicare rate. Emergency charges are processed at the provider's Medicare rate plus an additional 100%. And air ambulance charges are processed at the provider's Medicare rate plus an additional 20%. Advantage Health Plans has a partner that offers a robust patient advocacy program. A team is available to help you find a provider who accepts the plan's reimbursement, as well as comprehensive patient advocacy if a balanced billing situation does occur. It is important for participants enrolled in the Choice Value 750 plan to speak to their medical providers in advance. Call and speak with a Kempton Care advocate to learn more or to get assistance with a balance bill. The medical ID card for the Choice Value 750 plan includes language that is designed to help providers understand your benefits and their reimbursement. It is expected that providers will still file claims according to normal industry standards. However, in the unlikely event that a provider chooses not to file a claim, Advantage Health Plans will work with you. Providers may access additional details about your benefits by logging in to the provider portal at AdvantageHealthPlans.com or using the provider faxback system. It is important to note that there are certain providers that are excluded from Advantage Health Plans. A list of these providers may be found at AdvantageHealthPlans.com. Now let's talk about the specific benefits available under the Choice Value 750 plan. Advantage Health Plans provides alternative options to help save you money and make better healthcare purchasing decisions. In order to make the decision simple, these alternatives are covered at 100%, waiving all patient responsibility. Many medical services are available through KPP free, such as orthopedic procedures, diagnostic imaging, general surgeries, urology, ear, nose, and throat, gynecology, oncology, inpatient cardiac testing, bariatric, digestive testing, sleep studies, and more. Using KPP free is as easy as 1, 2, free. Just call Advantage Health Plans to get started. Your laboratory services may be covered at 100% if you choose to use a laboratory provider that is directly contracted for enhanced benefits with Advantage Health Plans, such as LabCard, Diagnostic Labs of Oklahoma, Quest Diagnostics, Clinical Pathology Laboratories, and more. Visit AdvantageHealthPlans.com for a full list of participating laboratory providers and draw sites. You may also receive some medications at no cost to you. We will discuss this further in a moment. Kempton Direct Access Providers is an enhanced consumer-driven benefit for primary care, preventative care, and urgent care services. When an eligible employee enrolls in Kempton Direct Access Provider, the monthly fee will be paid by Advantage Health Plans in the form of a subsidy at 100% up to $70 per month. For a full list of participating Kempton Direct Access providers and to learn more about direct primary care, please visit AdvantageHealthPlans.com. Be sure to check back as the provider list will soon be expanding. The individual deductible for this plan is $750. For participants enrolled in coverage other than employee, only 2 covered persons must meet the individual $750 deductible. The out-of-pocket maximum for an individual is $5,750, and the family out-of-pocket maximum is $11,500. The co-insurance percentage is 70%. Advantage Health Plans will pay 70% of covered charges after your deductible, while you will be responsible for the remaining 30%, up to your out-of-pocket maximum. The co-pay for physician office visits, specialist office visits, and urgent care visits is $35. Just a reminder that members who are enrolled in Kempton Direct Access providers will have no co-pay for services that are included in the monthly fee, such as office visits. Notice there is no benefit differential for an in or out of network provider. Remember that your benefit is the same, and all charges are held to a reference-based price. Your deductible and coinsurance will be applied for all medical services performed in an emergency room. There's an additional $200 copay for emergency room visits, but the copay will be waived if you've been in an accident, your condition is considered life-threatening, or you are admitted to the hospital. For procedures performed outside of your physician's office, a copay of $300 will apply in addition to your deductible and coinsurance. For some surgical procedures performed in the physician's office, the office visit copay will apply. Remember, if you use KPP-free, services are covered at 100% with zero out-of-pocket costs. Pre-certification of all inpatient confinements, outpatient surgeries, and sleep studies is required. Pre-certification is ultimately your responsibility, even if the medical provider often performs this task. If you are unsure if your medical service requires pre-certification, or to find out if your provider has completed this task, please call and speak to a Kempton Care advocate. For outpatient laboratory services, Advantage Health Plans will pay 70% of covered charges, while you will be responsible for the remaining 30%, up to your out-of-pocket maximum. Your deductible is waived for outpatient laboratory services. If you choose to use one of the laboratory providers who are directly contracted with Advantage Health Plans for enhanced benefits, there will be no out-of-pocket cost. A list of these providers is available at AdvantageHealthPlans.com. After you meet your deductible, Advantage Health Plans will pay 70% of covered charges for diagnostic imaging services. You will be responsible for the remaining 30%, up to your out-of-pocket maximum. If you use KPP free, your diagnostic imaging will be covered at 100%, waiving all patient responsibility. All charges for inpatient hospitalization are subject to your deductible and coinsurance. You are encouraged to talk with your medical provider in advance of any medical services to ensure that providers' acceptance of the plan's allowable reimbursement. Providers who choose not to accept the plan's allowable reimbursement may choose to balance bill the participant. For assistance with a balance bill or to learn more, contact Advantage Health Plans. Your prescription benefit plan through Advantage Health Plans is administered by Southern Scripts. It is important to remember that the use of a participating in-network pharmacy is mandatory, even on the Choice Value 750 plan. Prescriptions filed at an out-of-network pharmacy will not be covered. Check AdvantageHealthPlans.com for a list of excluded pharmacies. For prescription medications, this plan has a $15 generic copay and a $55 name brand copay. A 102-day supply of covered maintenance medications is available at your pharmacy or by mail order. Generic maintenance medications have a copay of $30, and a name brand maintenance medications have a copay of $110. Don't forget, if you choose a name brand drug when a generic drug is available, you will pay the name brand copay plus the difference in cost between the generic and the name brand drug. There are specific high cost name brand prescriptions that have a lower cost therapeutic alternative. If you choose one of the medications included on the therapeutic alternative drug list, your copay will be 50% of the cost of the drug. A drug will not be included on this list unless it has a lower cost therapeutic alternative. This list is available at AdvantageHealthPlans.com. You may obtain some medications, including some over-the-counter medications, at no cost to you. The list of covered Premier Drug tier medications is available at AdvantageHealthPlans.com. Specialty medications are exceptionally expensive prescriptions used to treat complex chronic conditions like cancer, rheumatoid arthritis, and multiple sclerosis. These medications sometimes require additional medical management and oversight. Specialty medications have a $150 copay and must be obtained through the Southern Script Specialty Pharmacy. For assistance with your out-of-pocket costs for some medications, please contact Advantage Health Plans and speak to a Kempton Care advocate. Be on the lookout for communications from Script to Savings. These communications may come via email, text message, or snail mail. If you receive a communication from Script to Savings, it will include information about how you can save on your prescription medication costs. Here are some final reminders about how you may talk with your physician about healthcare costs. Number 1. Always ask your medical providers what the total cost of your medical treatment will be. As a participant on a self-funded benefit plan, you should be asking for the total treatment cost before you have non-emergency medical procedures. Number 2. Remember that the Kempton Care advocates can help you understand your benefits and provide tips on speaking with your provider. Number 3. Remind your providers that you are enrolled in a self-funded benefit plan for which your employer pays your claims. Number 4. Let your medical providers know that for specific procedures, you have a 100% benefit. If they are willing to match or closely approximate the price available through KPP Free, then their services could be covered at 100%. Number 5. Remember to ask if your provider is willing to accept the reference-based price as payment in full with no balance billing. There are many resources available to help you understand reference-based pricing and your benefits. If you need assistance speaking with a physician or facility about whether they will accept the plan's reimbursement, pre-service advocacy is available. We can assist you in finding a provider that has agreed to accept the plan's allowable reimbursement. If a balanced billing situation does occur, there is a comprehensive patient advocacy process in place to assist you. Visit AdvantageHealthPlans.com to download educational reference-based pricing guides. Additional information about your benefits, including a summary of benefits and coverage and your summary plan description, are available by visiting AdvantageHealthPlans.com and logging in to the member portal. If you have questions about your benefits, please call 800-324-9396 to speak with a Kempton Care advocate. They are available Monday through Friday, 8 a.m. to 5 p.m. Central Standard Time. Thank you for listening to this explanation of the Choice Value 750 plan, and thank you for being a participant in Advantage Health Plans.